Spinal stenosis and sciatica can affect people in different ways. Typically, when you come to see me in my clinic, I'm able to diagnose your condition through taking a thorough history and by examining you. There are various tests I can do to see how much pressure the sciatic nerve is actually under. Occasionally, I may need to investigate you further, and an MRI scan is a very useful tool for doing so. Hi, I'm Kiran Divani. I'm a Consultant Orthopaedic Spinal Surgeon based in North London. Today I'd like to talk about spinal stenosis and sciatica. I think that they're both very important conditions of the lower back, and it's something that I routinely see in my outpatient department. By talking about these conditions, I'm hoping to give you further information as to what they actually are, what the potential causes are, and how we can then go on to treat it. Spinal stenosis is essentially a narrowing of the spinal canal. The spinal canal is made up by the vertebral bodies and the intervertebral discs in the front of the spine, and with a bony arch at the back. And if you get any sort of wear and tear in the spine, which may be because of dehydration of the intervertebral discs, where the discs bulge backwards, or if you get arthritis in the facet joint, which causes the bone to bulge forwards, the nerves that run through the spinal canal can get squashed and sandwiched. That's essentially what spinal stenosis is, and it can lead to a typical set of symptoms known as neurogenic claudication. Patients who experience neurogenic claudication typically have pain that starts in their back with a heaviness in their legs. They may find that the pain radiates through their buttocks, the back of their thighs, and into their calves. Typically, it's felt as a cramping, an achy pain, and that pain typically comes on when you stand for prolonged periods or when patients start to walk. Typically, resting by leaning forward to offload the back or sitting down can help wash some of those cramping, heavy sensations away, and then they're able to get going and start walking again. Sciatica is slightly different to spinal stenosis in that it's a very sharp, acute nerve pain that radiates down the back of the leg towards the foot. And this typically happens when a nerve or multiple nerves of the lower back are being impinged. Now, typically, that impingement or compression can come from a prolapsed disc. And this is an incredibly unpleasant sensation and is usually felt as a pins and needles, electric shock, tingling. Sometimes can also cause a numbness or a weakness in the foot as well. Spinal stenosis and sciatica can affect people in different ways. Typically, when you come to see me in my clinic, I'm able to diagnose your condition through taking a thorough history and by examining you. There are various tests I can do to see how much pressure the sciatic nerve is actually under. Occasionally, I may need to investigate you further, and an MRI scan is a very useful tool for doing so. This allows me to visualize the different anatomical landmarks in greater detail, such as the intervertebral discs and the facet joints. It also allows me to see the relationship of the nerves to these anatomical structures. It's also a very good way of finding out where the compression is and the general overall alignment of your spine. Now, the treatment for both of these conditions usually starts conservatively, and that's in the way of modifying your activities by avoiding all the aggravating factors, taking simple pain relief, and also neuropathic agents to help alleviate some of that nerve pain. Usually, back pain, sciatica, and some of the symptoms of spinal stenosis can be self-limiting. However, should they persist, there is a second line of treatment which does involve spinal injections, and that involves injecting local anesthetic and a steroid around the nerves to help take the inflammation off them and improve the pain in that way. Sometimes patients may not respond to conservative treatment, and if that is the case, surgical intervention may need to be considered. And again, that really does depend on the type of the pathology. If the sciatica, for example, is being caused by a disc prolapse, I may need to perform a microdiscectomy operation, and that involves making a small bony window in the back of your spine so I can move the nerves to one side, and then I can retrieve the disc that's prolapsed and causing the compression on the nerves. If the spinal stenosis is because of bony arthritis, I may need to remove a larger window of bone, and that is known as a laminectomy. Sometimes I may need to consider fusing your spine, and that involves inserting screws, rods, and a metal cage. And whether I need to fuse your spine or not depends on various things, and some of those factors can include the spinal stability and the alignment of your spine. Before I conclude the video, I think it's very important to mention something known as Cauda equina syndrome, as this is a medical emergency and it's when you should seek urgent medical advice. This is a syndrome that's characterized by pain that shoots down both of your legs, i.e. a sciatica that's affecting both of your legs. It's associated with numbness in the private area, and it's also associated with bladder or bowel dysfunction. And this happens when all the nerves of the lumbar spine are being compressed acutely because either a big disc prolapse or because the spinal stenosis has reached a critical level. If that does happen, it's very important to seek medical advice because it's a time-critical condition and you often need surgery quite urgently. To find out more about me, to find out more about these conditions, please visit kdspines.com.